Thank you. Good evening, everybody. Welcome to today's meeting of the Health and Wellbeing Committee. This is a public meeting and members of the public and press are permitted to report on the proceedings. Reporting includes filming, photographing, making an audio recording and providing commentary on proceedings. Please note this meeting is recorded and streamed live. These recordings are published on the relevant meeting page of the Council's website. By choosing to attend this public meeting, you are deemed to have given your consent to being filmed or recorded and for any footage to be broadcast or published. If the alarm sounds, the premises must be evacuated immediately. Do not spend time collecting personal belongings. All emergency escape routes are clearly signed. Once you have left the building, the assembly point is in the High Street opposite the Guildhall. Members and other speakers are reminded to use their microphone when speaking. Appointment of substitutes. I think we have some.
Chair, we do have some substitutes with us tonight. So we've got Pat Agar here for Richard Udell, Steve McKay here for Lucy Hodgson, and Louis Stephen here for Steve Cockram. Just to note also, we've had apologies from Shafaz Ditta.
Thank you very much. Any declarations of interest? No? Okay, thank you. No public participation? No. Okay, which brings us on to the minutes of the last meeting, which does feel quite a long time ago, 18th of July, when there was extreme weather. Gosh, that does definitely feels like a long time ago. I'll go through it page by page. Any amendments or anything to follow up on? So page 1, page 2, page 3, and page 4.
Thank you, Chair. Page 4 refers to a point I asked about impact of poverty on students. Can local high school heads be invited to attend a committee meeting to speak? Corporate Director Operations, Homes and Resources stated that he will look into this.
Chair, apologies. We've not picked that one up yet, but I will take that away from this committee. We're talking to schools for a variety of reasons at the moment around projects, so that will give us an opportunity to be able to do that. And I'll liaise with Chair and Vice Chair around organising that. But apologies, Councillor Norfolk.
Thank you, Lloyd.
Thank you. So if we pick up that action point going forward, and then happy to sign off as a true record. Okay. Thank you. Setting of the budget. I think that's over to you.
Thank you, Chair. This is the continuation of the annual budget setting process for 2023-24. You'll recall that we had the all members briefing back in September. And this is the next stage in the process. We're following exactly the same process as we've used for the last couple of years, so members should be familiar with that. The purpose of this report is to invite members to consider any amendments they want to make for next year's budget, or whether to consider any opportunities that they may see that we should include in that budget setting process. And for those to be brought forward to the January meeting of this committee, and then, if approved, to be carried forward to Policy and Resources, and ultimately to the council meeting for finalising the budget in middle of February. There's a couple of specific notes for this committee in paragraph 4 in terms of projects that were previously recommended by this committee and the updates on those, and then also the capital programme for the current year and the forecast for the end of the second quarter, the half year as part of that, which members may want to review to consider any thoughts that they have. I don't think there's anything else to add as part of that, but I'm happy to take any questions if there are.
Any questions around the table? Robin?
Again, thank you, Chair. I'm just wondering what the difference between in Appendix 1 and 2 is on the disabled facilities grants, because it reads to me in Appendix 1 that 2022-23 we've got a budget forecast of 1,070,000, and yet on Appendix 2 that figure's 688.
While I'm doing that, do we have any other questions?
Chair, thank you. I just wondered.
£1,000 that was made part of the 22-23 budget. Has any conversations taken place at chair and vice chair level with officers as to where specifically that money may ultimately go?
We haven't had specific conversations as yet. I think that money was sort of put aside in this year's budget, and the cost of living task and finish group, of which I think there are a couple of members in the room, has sort of overtaken or has been working on that. So I think there will likely be need for, and there is further work to be done around the recommendations of the Child Poverty Action Group, because we haven't specifically picked up many of those as yet.
So in response to Councillor Norfolk's question on the disabled facilities grants, Appendix 2 is the 5-year capital plan that was approved last February as part of the budget setting. And at the time, we were predicting a DFG of 688,000 a year, which was based on the amounts we've received in previous years. In the event the amount we received was more than that, and including the unspent amount from the previous year that was brought forward, gives us the figure on Appendix 1 of just over £1 million, which is then what's available to be spent this year, and the forecast at the moment is to spend all of that.
Any further questions or comments from members around the table? If I can say then that there are some discussions with regard to other aspects of council budgeting, which budget spend that maybe should come to this committee, given that we are the committee with responsibility for poverty, as it were. So the ones that the sort of budget lines that are under discussion, disabled facilities grant, as we've just had a look at, because that is expenditure that is very much linked to health and well-being, about discharge from hospital and about helping people to live independently. The other possible budget lines are the discretionary welfare assistance scheme, which by definition is for the assisting those who are struggling economically, and council tax relief. And I guess, you know, I would be interested as chair and the vice chair to look at expenditure for those for this year with or taking a view to adequacy or what the need might be for next year?
Yes, we can certainly prepare the figures for those and advise accordingly.
So the recommendation for this agenda item, consider the priorities and recommend any change of emphasis. So people happy with what's here and potentially looking at taking forward other things. Thank you very much. Nods all round. So moving on to Q2 performance report.
Thank you, Chair. This is the Q2 performance report for this committee. In unusual fashion, I draw your attention to Appendix 1 of that report. The appendix sets out the key projects that fall under the oversight of this committee and the key performance indicators. And just to bear in mind, the list of projects and key performance indicators is lighter than other committees. I think we acknowledge that the committee is still in its early days and they will develop over time. In respect of projects and action, in respect of projects, first of all, sorry, the active travel project, which committee received an update from last time out from David Sutton, is showing as green with all strands of that on target. The implementation of recommendations from the Child Poverty Task Force group is showing red. We need to amend some of the timelines and milestone dates there. But we will have an update report for this committee in January, and we will be able to show some progress there. We've discussed previously the integrated care system and how we intend to develop the Worcester City Health and Wellbeing priorities. So we've got narrative against each of those projects, and even though some are showing red or amber, hopefully members will be able to pick up the work that is being carried out. In respect of the performance indicators, the number of ICS health initiatives supported, still small numbers there, but I just think we need to be a bit clever about what we're reporting. There is lots of work going on. So last week, we're just about to support coordination of warm hubs over the winter months. So it's things like those probably that we aren't reporting at the moment and that we need to. Warwick will present on access able in a moment, but we are remaining steady on the number of access guides in place for Worcester. The number of rough sleepers engaged with is going up slightly, part of our outreach effort. We've seen an increase in the number of rough sleepers who've transitioned to accommodation as a result of outreach. And some really good narrative there from the team around the work that's being carried out around that. Number of DFGs and people living independently has risen, and we are one of the districts across Worcestershire that's set to spend all of its DFG allocation this year. So that's really positive, in spite of some challenges around recruitment of occupational therapists. The number of exercise by prescription referrals, that's gone up in the last quarter, and members should have received a briefing note in the last week or so around that project from Alan New. So I'll stop there, Chair, but happy to take any questions.
Louis, want to go first?
This is a committee I don't normally go to, so apologies if I ask a really stupid question. On the active travel project, you've got active travel corridors starting in November this year, going on till next September. Can you just give a little bit more information about what these active travel corridors are and where they are in the city?
Chair, if I may, I would probably do that a disjustice if I tried to explain that. And this is very much David Sutton's project, so I'd be more than happy for us to provide a written response to that question, Councillor Stevens, following the meeting. But yeah, I'm not close enough to it to be able to do it justice, I'm afraid.
Okay, thank you.
Yes, I've just got a couple of questions relating to this report. Page 17, the number of ICS health initiatives supported. I noticed it's dropped down from 2 to 1. Just a question, I noticed the graph has got like part of a decimal, which I take it shouldn't be there. 'Cause you can't have like, 0.5 of a initiative, yeah? 'Cause it's a bit confusing, but basically, yeah. What initiatives have we got planned for the next quarter, or is it going to like to be one again?
I don't know, I'll work with Stephen's. You want to turn off, Stephen? You want to turn your...
Mic off.
Oh, yeah, good. As I said, Chair, there is much work going on. I just think we have to box a bit clever in how we're reporting here. So, for instance, we had the last district collaborative meeting last week. We are supporting Age UK starting to operate again out of GP surgeries. We are supporting the coordination of warm hubs. So there are 10 warm hubs that are planned to operate across the city over the winter months. And we identified that none of the warm hubs seem to be talking with each other or working together. So we're supporting an initiative around that. And obviously there's a report later on in the agenda where we're looking to invest in some additional mental health support. So they're just a couple of examples of things that we've got planned or are working on. But again, there'll be much more, particularly from Warwick and the team, around how we can report on that particular KPI.
And the other question on page 22 about the diabetes program and that. I discovered back in 2005 I was diabetic. There's a lot of adults who don't realise they are until they feel ill. They go to the doctor and the doctor tells them you've got diabetes and that. So it's very important that people are aware of it and it's prevented. Really, my question is related to the programs you've got, where you've got a number of people starting, but actually only about half of them are actually completing them. Is there anything we're doing to try and get more people to, first of all, join these programs, and secondly, more importantly, to complete them as well and get the benefit of it?
Yeah, thank you, Chair. I think the briefing note that we've sent out does cover some of that off, but just from memory, to try and answer the question this evening, obviously the referrals come from the surgeries themselves, so we're reliant on surgeries picking people up to invite them to the programme. I think some of the learning in order to try and keep sort of dropout rate low is that simple things such as text reminders, just to remind people about when invites and appointments are. But also there was some feedback around the previous course. I think Councillor Hodgson was sort of 12 one-hour sessions. I think people said, look, we'd rather a condensed programme. So I think for the next phase of this, it's going to be 6 two-hour programmes rather than 12 one-hour programmes. So they're just two examples again. But again, I know Alan did set out some of the learning in the briefing note, and if a member of this committee hasn't received that, we can send that round again if that's helpful.
Yeah, it came out in the members' weekly information sheet. So I think there's perhaps a learning curve, isn't there, for the PCN and ourselves in how these things might best work. Karen?
Thank you, Chair. Transport was because I had an email conversation with Alan as well. Transport was an issue, so they were looking into how to improve the transport. Obviously, because some people struggle late at night. My question was about the warm hubs. You might want to mention it on Wednesday, perhaps, if you're with us on Wednesday. But it's whereabouts are they around the city? Because I think it's being done through the Worcester Community Trust, and therefore it's the 6, so it's not covering all wards.
Thank you, Councillor Lawrence. There is a website, and Warwick's going to very quickly try and find out what that website is called. that is mapped out where warm hubs, registered warm hubs, are across the country. So I think Warwick's ready to let us know.
Yes, it's called www.warmwelcome.uk. So the idea is that everyone we know about registers on that website, so that frontline services, you know, healthcare workers all know where to direct people, or you know, or where to look, so they can advise people, rather than requiring everyone to go on the internet to find them.
So I think from the last time I looked at that site, we had some of our own community centres, WCD community centres that were taking part. I think there were a couple of county council venues, the Hive possibly, and another library. And I know there were 2 churches as well that were signed up. So it's a variety.
Thank you.
Thank you, Chair. Appreciate this is a performance paper and performance chart on page 17, going back to page 17, the integrated care system. I'm just wondering if there's been any feedback at all already, or if there are sort of plans to catch any feedback in relation to any of the support workers having difficulties accessing care to mental health for young people, or if the young people themselves are reporting to the care supporters that they are having any difficulties at all. I just think it'd be worthwhile capturing that.
Again, I may sort of defer to Warwick to fill in some of the gaps here, but I think what we are picking up is not so much from people with existing issues reported into care workers, but there seems to be both from the Howe College's point of view and from the GP surgery, they simply don't have the staff to meet the demand that's coming into the front door at the moment. So that's what's driving our concern, and that's the reason for the paper later on in the agenda. But I don't know whether Warwick would wish to add anything.
Thank you, Chair. 2 things really. The first thing is I'm particularly pleased to see the focus areas for the collaborative work on page 16, because I think there's a wealth of research at the moment, nationally as well as locally, I know, that tells us that children who don't get a good start in life, who don't get good nutrition, stand a much higher chance of having a stroke or heart attack. It's about double. So, you know, it's better to act now, really. And how could we actually allow the city's children to be in that situation? You know, I think there's a moral imperative, isn't there, for all of us to support and help. And also, we know it's been starkly obvious during the COVID crisis about where the health inequalities are within the city. So I'm very pleased to see this, because it really is something I've been banging on again. I went on and on about it, and I think you know, Steve, that I went on and on about health inequalities while I was at county. And finally, you know, something feels as if it's moving, and I'm so pleased to see it. And the other thing was the possibility of a bottleneck in the homelessness situation that's referred to on page, at the bottom of page 20, or towards the bottom. And it's saying about the limited accommodation for people with these kinds of needs, which of course is true. But it's really quite a worry if we can't cope with the number of people who are coming into the service. Do we know anything about numbers there, and what we're looking at, or what we're forecasting even?
Again, Chair, we can provide some further information to members on current numbers. I think from just looking at the winter, I think we will be absolutely fine in terms of providing emergency placements, you know, particularly in times of poor weather, for us sleepers. I think some of our challenges around that move-on accommodation, and again, some members will recall probably 2.5 years ago now, we approved basically the council has set out on a journey to try and procure additional temporary accommodation up to 64 units. So we've made a start on that. We've procured 12 units of accommodation, Bromyard Road, Knowlbury Road, and there are a number of other properties that are currently in the pipeline that we're actively having conversations around. So I think it's definitely different between emergency placement and what we call move on. We're fine for emergency placements. You know, that's an absolute imperative to us. But that piece of work around procuring move-on accommodation continues to prove challenging, but we are actively talking about that at the moment.
Yes, thank you very much, Chair. A quick question around some of the KPIs. They seem to be, we don't have targets for all of them. I was just wondering why that is. And then specifically the KPI around the number of disabled people living independently through home adaptations. I was wondering whether we've consulted any learning disabilities or disabilities charities to try and help us with achieving better outcomes with that.
Thank you, Councillor Spidrowski. I think in terms of the your first question, I think we're probably still perhaps in baseline mode. We're early days of the committee and perhaps not knowing where we are in terms of a target. So I think getting through this year will allow us to put some targets up next year. And then in terms of your second question, I'm not aware we've done that, actually. A lot of our DFG grants are promoted through, people coming out of hospital or referrals with GPs and that sort of thing. But so that's definitely something I can take away and ask the group that sort of the county-wide group that monitors and works on disabled facilities grant to look at.
Any further questions or comments from people? Thank you for those. There's some useful points raised. It is still relatively early days for this committee and early days in terms of the evolving integrated care system and relationships around that between the council and the NHS, and as to where we as members and officers, how we interact with that. So we're on a bit of a learning curve, but it is really good to see some positive work and some positive projects coming out of that, which is a good indicator in itself. And whilst specific action from the Child Poverty Task and Finish Group recommendations has been limited, it's clear that that piece of work and that thinking has influenced officer thinking and has influenced the way forward in other projects. So thank you to officers. Thank you for your questions. So we happy to note the performance in report. Thank you very much. Which brings us on to item 7, Access Able contract for Worcester.
Thank you, Chair. If members remember back in March, we brought a paper about Access Able for your consideration, and the action was to negotiate a new longer-term contract to bring back to this committee. So just a quick summary of what Access Able is. It's an online guide for people to review and almost sort of map out their journey either to a specific premises or a route in Worcester in this case, and which means that people with lots of mobility problems or sensory impairments or health conditions can actually plan their routes and understand what facilities are when they arrive. So it's a really good tool. It's a tool that's used nationally, so it's not just Worcester that benefits from it. And I've given a bit of a guide in 2.4 or links to a guide if members want to do a bit more research into the background to how it was created in the first place. Worcester itself, as part of its contract, has 320 access guides that are published. It's now on an app as well as a website, so fully mobile for people to use. Worcester is a bit unique because it has a guide for the Victorian Fair. It's the only event on their website. And what happens is obviously we've got our 321 guides, but other organisations, national chains also have their own guides. So it's not just like Worcester and then that's a black hole. You have like Marks and Spencer, Tesco, other supermarkets are available, and Barrett and Holland and Crown Gate. Our NHS Trust has guides. The University of Worcester has guides, so you can sort of see how the jigsaw maps together to create a much better picture for people to come and use the city. So the most recent review of our guides shows in 2.8 that 7,200 unique users have used it in a year, and they have viewed 14,000 pages relating to Worcester guides. The top one is Crown Gate Bus Station, followed by Sixways Stadium. The other benefit of this, obviously, it isn't just city centre, is the other thing to point out, because obviously Sixways, Ashwood, and Purdeswell Leisure Centre are outside the city centre. So it's not just sort of focused on the city centre, because all of our community centres also have guides. But what we are, or what we have developed more recently, especially with the Purple Flag application, is a closer working relationship with Worcester Bid around Access Able. They also see it as a really important tool for people to come and visit Worcester. And therefore, our next piece of work, which we're developing with the Access Able sort of technicians, and our other online technicians, such as Discover, the Discover app, and our website pages for people to create a much better link between the web pages, and that's work that's ongoing to be able to sort of connect them in together and use them easily. We've also commissioned a strong word, but working with Access Able to design our own window stickers. So once that's signed off, we can sort of go around all the locations that have guides and put window stickers up on the shop fronts or the points of contact, so that people know that there is a guide for them to follow in future or to use through the app. And there's potential of using QR codes in those stickers as well. The Worcester Bid are also keen on doing welcome packs for, well, they already have welcome packs for new businesses that come to the Worcester Bid area, and so the Access Able guide and the information about it will go into those packs too. So you can sort of see how working collaborative with partners will improve visitors' access to the site and promote it to local businesses as well to use for their own benefit. So, and then going forwards, Worcester Bid have also put some money aside to increase the number of guides that are available in Worcester. So specifically targeted within the Worcester Bid area, they've allocated £2,500 for 22-23, £5,000 for 23-24, and an equivalent £5,000 for 24-25. And in the offer that we've had from Access Able, they've included a suite of varying costs depending on the size of the venue and location to be able to deliver guides at various rates. So the preferred option from our negotiation with Access Able is that we're looking at a 3-year contract with them. The contract year starts on December the 1st. But there is a fairly long notice period in the lead up to, and obviously with the budget cycle, which is why we're working now to look at next year's contract, as it were. So a 3-year contract, and then with the option of doing a 2-year extension. And so with the basic guides, or the contract includes the maintenance and management of those guides. So they'll go out and check with each of the premises, make sure there's nothing changed, and resurvey it if anything has been changed. But we've also wanted to increase the opportunity to do more guides in addition to what Worcester Bid are focusing on. So you can see in 3.3, we've set out a plan for future surveys. Initially, around increasing the number of routes that connect, make up someone's journey as they come into Worcester and move around the city, based on train stations, bus stations, and connecting them into our facilities and places where we want them to go. But also in response to the fact that we've also, the council's invested quite a lot in its surface structure, and it's changed quite considerably over the last few years. So, but also to plan for those future town centre projects as well, so you can sort of see how various aspirational projects are in there for the future. Obviously, this is open to change. This is sort of a planned approach to the future. So in summary, we'd recommend going for with 3 years funding identified from the pandemic reserve, and then to bring a report back in that 3rd year to this committee to for you to consider an extension. Any questions?
Thank you very much, Warwick. Questions, comments? Pat?
Thanks. I mean, I've come at short notice to this, so I've been quite impressed actually by what I've read, and we'll certainly be looking into it a bit more. I think it's value for money, basically, because it's not a huge amount of money to get this kind of result, and I think it's really excellent value. And the other thing I'd like to ask is, you're talking about sensory impairments, so clearly we need to think about people who are blind or sight impaired. And I was chatting with one such person not long back who said that the street furniture was tripping him up round the centre of Worcester. He thought the A-boards in particular were too far out. Stuff like that. It might seem small, but you know, he was bruised and battered and he'd fallen over a few of them and it wasn't very funny. And I wondered also if there was an audio facility with this, not just people who are disabled in other ways, and what we could do about those A-boards and other things that are trip hazards.
I think county have a design standard, don't they, for the streets? But I'm not aware of an audio version of Access Able. I'm more than happy to ask them though to see if they've got one.
I think when they are looking at facilities as to whether there is, you know, an audio loop in a hall, so in that sense, it's catered for.
In the premises,
yeah.
Sorry, I was speaking.
You know, and I thought that wasn't a bad idea.
Do you mind if I just respond to Councillor Egar's point around A-boards? It's something that we've discussed actually. I think through COVID, there was obviously a relaxation around tables and chairs outside premises. I think it was very, as it should have been at the time, very supportive of business. I don't think we've seen the shrinkage of tables and chairs and boundary areas back to where perhaps they need to be. So that is definitely something I will pick up with the County Council and Worcester Regulatory Services to be able to look back into.
I've got James next.
Chair, thanks very much. Really supportive of this. I can recall you and I believe, went to the presentation of this some years ago now, and it's Disabled Go heading at that time. It's a really, really good initiative, and I think we should give it our full support. The only question I've got really is do we have any data to offer any insights in the take-up rate in comparable authorities or cities? Is Worcester, you know, a really strong performer in that respect, or is there more we could do?
Thank you, Councillor Stanley. There is more that we can do. As I've detailed out, most of the access to Access Able for Worcester is through Google searches, or people going direct to the site itself, so they know it's there already. So as detailed, our push in the short term is to make sure that our own website, Persian Leisure Centre's website, Worcester Community Trust's website, all direct people to the additional value of the guide so that people can plan their journeys better. My approach is again with the new routes surveys that'll hopefully help people get around the city better, or encourage them to explore more as well. So there's the two-pronged approach to really make sure that signposting to the website is better from our own sites and sister sites. But yeah, we could do better.
Two questions. Again, I think this is an absolutely fantastic project, and I think the numbers speak for themselves in terms of the 7,200 unique visitors to the website on this for this application. My two questions are: one is about the budget implications. I really think this is something that we've got to protect, and I'm sure everyone else here tonight would also agree with that. Is it genuinely all within the current budget, or is there going to have to be new money found for this? Because I'm worrying about if there's any budget cuts or things that have to happen in the coming years, how vulnerable this might be. So is this already in the medium-term financial plan? That's the first question. And the second question is, you made reference to some of the changes going on with things like the Keepbacks Bridge, the Scala Theatre, and so on. I'm just wondering whether you're very able, I think, capturing these new projects. I wonder whether we ought to be putting something in a systematic way into the planning process, so they're actually captured within the departments which do planning applications and all those sorts of things, because then it might be done automatically then, and may even get developers to pay for it as well, for each one that they do, perhaps. I don't know. So, yeah.
Yes, thank you. In response to the point about the funding, this is not part of the base revenue budget for the council. It's funded separately from reserves, and the recommendation here is to set aside the 27,000 for the next 3 years. In terms of the comment about is there therefore this at risk from being stopped and so on, not at present, but that it sits alongside any other service of the council in terms of where it stands as a priority.
And thank you for that idea, Councillor Stevens. It's a really good one, and I think there's a variety of ways of doing that. You'll see some planning applications will come with what they call sort of advice conditions, so you don't need to comply with them, but it's a prompt to a developer. I'm not sure we'll be able to get away with asking them to pay for it, but we will certainly try and do all we can to try and work that into sort of decision notices. And encourage businesses to be part of the system.
Thank you, Chair. Forgive me if I've missed it in the report or if it's in the links, but it does look an impressive system. It does look a great idea. And we've got, as Louis pointed out, 7,200 unique users. But do we get any feedback from those users as to whether they think it's really helpful or not, as the case may be?
I'm sure there is a feedback loop, but I haven't put in the report. You're quite right. We'll bring something back to committee from Access Able. Yeah.
And I think it's probably only a tiny percentage, but a couple of times that I've looked on the website, there is some sort of customer feedback on there, which is very, very positive. But again, that's only a very, very small number. But yeah.
Yes, just a question about page 27, 3.3, when you talk about these various routes you're going to set up and that. What is the actual process of actually doing this? And what information does the route actually contain? How does it actually look like? What do you do to actually get these particular routes?
So a surveyor will go out and map it, walk it, and record all the different types of details, technical information that they think is valid. So, like if there's a change in colour on the floor, that can be an issue for some people. It'll include, for the routes, if we're talking about specifically, is whether it's dual access, you know, the surface material, what's there, so that however people are using that route, they can make a judgment about how easy it would be or what things that they have to consider when they go through there. So yeah, lighting, you know, surface materials, spaces, all those sorts of things would be mapped.
And will you then be putting recommendations if you see something is sort of not up to the standard it should be, and relay that to the various bodies? For example, if a pavement is in a bad state or the lighting could be improved or some other aspect?
Most of these surveys are going in where we've done works along those lines, like the Trinity and area and those sorts of things where we're doing that work. This really is about surveying so people can make their own judgments and decisions about how they move around. We haven't used it as a feedback mechanism for improvements. It's normally around when you've done something to improve it, then you survey it for people to make those judgments. But certainly, if that helps, county, we could look at you know, seeing whether there is a feedback loop we could include.
Thank you, Chair, and I'd like to thank officers for the report as well. Hard work done for it, and it's nice to hear such all-round support for it in this committee. That's one less thing for me to have to argue for during committee. Very pleased to see that we're getting we're broadcasting this across the other websites. I'm just wondering if there's going to be any other publicity about this through the press, maybe. I don't know. Is it just websites that we're going to publish to other little pieces of, you know, pamphlets that we can, or leaflets that we can post as well somewhere, some of the community centres where people, you know, they won't necessarily go to the website, but they will visit the community centre and notice these things. QR codes, I think that's a great idea, I really do, just to broadcast these things from a technology perspective. And I'm really, really happy to see some routes going in there as well, just to, from a wheelchair pushers perspective, knowing where things are friendly for wheelchair pushers, in a positive way, actually, just thinking about how that sounds, you know, is really good from that perspective as well. So I think, you know, I just want to echo everybody's thanks for this report and all the support as well. Thank you very much.
Thank you, Chair. I did have a chance to test it a little bit, I think last year when I was first introduced to this. My first question is, do we have plans to engage with the businesses in the city who are not part of it and somehow encourage them to subscribe to it? So the reason I'm asking about this is it's a substantial chunk of money to be part and shown on the guide. I just did a quick search now, put college near Worcester. The only college that's coming up is Halzowen College. So I'm thinking the obvious ones, if somebody comes to a renowned place like New College in Worcester, which is a centre of learning for people with visual impairments, would it be useful to encourage them to be part of it? That's one obvious thing. I'm thinking about you know, people on the spectrum and the noise, sensory overload as well being an issue. I think the encouragement is one thing, and that's the one question that I have. And the second thing is, are we consulting when the surveyors come to do those plans with the local service users? And when I say local service users, I'm thinking local charities who represent their membership when it comes to disabilities, sensory needs, and various other support needs that they might have.
Yeah, thank you. So the plan obviously it's a draft survey plan, so we can flex that, or if we have more capacity to do more surveys, certainly we could be more targeted to certain locations. I thought New College was on there, but yeah, could be easily confused and not pick that one up. But certainly, so yeah, as I mentioned in the report, Worcester Bid are very focused on increasing the volume of guides that are in the city centre, and we have started to pick out where we feel obviously our buildings need improvement, or guides where they haven't picked up development. So so new guides, absolutely, we can add to the list or the wish list, as we expect. If we want to carry on going forwards, we can keep building out the number of guides. In relation to the other question, the Access Able themselves pride themselves on being the highest level. It's all sort of guided by research that they do. So I don't know whether, well, they won't be speaking to our local charities and organisations. They'll be working at a national level or with it, or from the university that designed it. So it's not part of the existing package, but yeah, I presume what our local people would be saying would be the same as the research into guides. But yeah, we can certainly look at that, whether there's an opportunity or whether they've got forums that they test their guides on, to see whether we can get people involved in those forums.
I mean, just to follow up on that, I mean, it's my understanding that the surveys are done by local people. So New College are likely involved in doing the surveys of public buildings within the city. And with regard to New College itself, it's not a public building on the whole, if you see what I mean. So that the main aim of Access Able is to map in very great detail buildings and places which are publicly accessible, so people know whether there's a disabled toilet and whether it's right transfer or left transfer and those kind of things. So I think that kind of partially answers what you're raising, Tom. So it is led by users. It is up to businesses whether they wish to engage in it, but it's to their advantage in terms of being as inclusive as possible to customers and service users. Any further questions? No, thank you. Thank you for all the work done on this and the level of progress. And I'm particularly pleased about it as the member who first initiated it as a small project to look into, and to see the extent of the spread of it, the extent of the use of it, and that it covers so many aspects of our city plan. So yeah, thank you for that. So are we happy, committee, to accept each of the recommendations? Yep. Thank you very much. Excellent, thank you. Agenda item 8, Worcester City District Collaborative, update on projects. Who's doing that one?
I should take that one.
Okay.
Thank you, Chair. Chair, this is a report that brings to members' attention some of the projects that the District Collaborative are working on at the moment. I'm not going to talk about integrated care strategies. Members have had reports on that previously, and we've also outlined the sort of roles of the Health and Wellbeing Board. Section 3 of the report sets out the aims of the Worcester City District Collaborative, and so they are the aims that we will work to for the next 12 months. And then, perhaps more importantly, paragraph 3.2 sets out the initial priority areas for us. So there's three in bold there, Chair, which is tackling loneliness and social isolation, providing the best start in life during maternity and children's health, and then targeting engagement in those areas of inequality and deprivation linked to health outcomes. So the collaborative has met. We've now met 3 or 4 times, and there's some really rich conversations that are ongoing. And Chair and Vice Chair have now been invited to those moving forward also. And the terms of reference for the group is at Appendix 1. To support the work of district collaboratives, the County Council, through its public health team, have made available what they're calling Being Well funding. And that's a strand of work that sits under the health and wellbeing strategy at county level. So basically, it's about trying to understand where work is best led, where it's best undertaken, and acknowledging the vital role that districts and even below that, local community organisations and charities play in tackling health and wellbeing. The funding they've made available is 25k a year for 3 years. And that's on offer to district collaboratives. And in September of this year, we put a bid together for that funding. And part of the criteria for that funding is that it required match funding. We've put 3 strands together. One is to recruit a programme coordinator to support the work of the collaborative. So in the district collaborative meeting, there are lots of agencies. We've all got sort of the day job to do. But what we're all struggling to do is to find resource to be able to support the work of the group and more importantly, drive the actions that come out of meetings and hold people to account. So what we want to do is to use the Being Well funding, the £25,000 per annum for the next 3 years, to actually drop in a programme coordinator that supports me as the current chair and the group to progress its work. In terms of the match funding, one of the bits of information that we've received over the last couple of meetings, as I referred to earlier, was that the demand for mental health support for young people in particular is outstripping the support in place, whether it be through surgeries or through colleges. And that's been very clearly indicated to us by the primary care network, the Worcester Primary Care Network. So again, in terms of the match funding, what we'd like to do and what we're seeking approval for this evening is to fund 2 posts. The first is a children and family social prescriber who would be employed by on-site advocacy for an initial period of 2 years to deliver that support and focus it on 7 to 11-year-olds and their families. And then the second post would be a wellbeing and emotional support practitioner. That would also be employed by on-site advocacy. Apologies, there's an error in the report that says it will be employed by Howe College. It would actually be employed by on-site. And again, to deliver that broad range of support and interventions in line with social prescribing for people aged 16 to 19 years old that are studying at Howe College and resident within Worcester City. There's more on those posts between paragraph 4.6 and 4.11. They go into some more detail on how that post would how those posts would work. There's a third post as well, Chair, that we're seeking to seek approval from for members to approve tonight, and that is around what we're calling bear with me, a sort of a support worker to work alongside Worcester Community Trust colleagues at the hyperlocal vaccination clinics. So I think we've recognised that the hyper-vaccination clinics have worked really, really well in terms of being able to encourage people more so from areas of deprivation into a community setting rather than a surgery setting to have their vaccination. But I think we've identified that's also a really good opportunity to talk to members of the community about what else is on offer and what else they can access. And so what we'd like to do is also use some of our pandemic reserve to fund a short-term post for up to 6 months through until March to sit alongside those vaccination centres and engage people as they're coming through the door, and open the door to other areas of support. So in terms of funding, in funding those posts, paragraph 6.1 sets out where we are in terms of the pandemic reserve, and at the moment there is £197,000 uncommitted within that reserve. As I've said, the programme manager to support the collaborative, we'd look to fund from the county council being well funding. But then the children and family social prescriber and the wellbeing and emotional support practitioner, we would look to fund from a mix of COVID-19 Conf Reserve and the Community Recovery Strategy Enabling Budget, which we can do that for 2 years. And then the vaccination engagement programme support work, we'd also like to fund from the COVID Reserve as well. And if members were minded to support that tonight, that would leave a small amount left in the pandemic reserve, just around about £14,000, should we need to spend it. We've checked back with county council colleagues, and they sort of support the use of COVID money for this purpose. It's focusing on areas of inequality and deprivation. That was one of the key criteria for use of COVID money. So they are supportive, and the bid that's been submitted to the wellbeing team at County Council, that's also been approved by the District Collaborative. That's gone through that governance process there. But because the match funding is from the City Council, this is why we've brought it to committee tonight for final approval before we go back to that group. I'll stop there, Chair. Happy to take any questions.
Thank you very much. Just to say, in the table about the finances, you don't mean Communities Committee, you mean Health and Wellbeing Committee, don't you? In the final column.
Oh, apologies, Chair. Apologies.
Okay. Thank you. Questions? Karen?
Thank you, Chair. I noticed we've got something in place for the 8 to 11-year-olds and the 16 to 19-year-olds. What about the 11 to 16-year-olds, the high school years? Is that something already catered for?
I think the areas of high demand were the areas we've set out within the report. So I don't think that there's a missing resource, Councillor Lawrence. That there is support in place across that range of age groups. These were two cohorts that in particular the primary care team for Worcester City was saying to us that the demand has gone through the roof basically, and they were really struggling to try and meet that demand.
Thank you.
Thank you, Chair. Thank you for the report, Lloyd. Paragraph 411 talks about the Howe College as a specific target. Are there other schools impacted by these issues with pupils in those age groups? And second, and possibly a more wider question really, I think we all understand what ABCD is. No, I don't actually. I'll reverse that one. We hear ABCD quite a lot, and I think in another committee I'm a member of, we've been promised a briefing on asset-based community development. Is that something that's pertinent for this committee as well, perhaps?
Just on the first point, yeah, it would be ludicrous of me to say that other 16 to 19-year-olds in other settings aren't affected by the same issues. We don't have any other colleges sat around the district collaborative table at the moment. We have Howe College, and it's a really fair point to raise. And I think what we'll probably need to see is to what demand looks like. But if there is any way that we can open this out to other students from other settings, then we'll absolutely look to do that. So we'll take that back to the collaborative, and we'll pick that point up. In respect of ABCD, I've got an expert to my left. I think it sits across this committee. Place and Economic Development Committee. It probably sits across all committees. It's not just the communities issue or a health and wellbeing issue. And we are working towards developing our the city's new community engagement strategy, which will be underpinned by ABCD. So we can try and develop a briefing note. I thought we'd sent one out previously through an all-member briefing. So what we'll do as a first, as a starter for 10, we'll resend that out as part of the Wednesday information briefing to members, but there will be a further report that will come back to Communities Committee. It's destined for, but I also think it's a fair shout that perhaps it could be a cross item to this committee as well, actually, in terms of shaping up the final strategy.
Thank you, Lloyd.
Yeah, thank you, Chair. I didn't hear your comment to Lloyd at the beginning, and I'm just unsure. In relation to page 36, the decision mechanism talks about Communities Committee.
Oh, that is incorrect. It should say Health and Wellbeing Committee, because it is a decision for this committee to make tonight about the use of those COVID monies.
Two things really. There's a statutory duty towards young people with special needs up to the age of 25. So it does go beyond 19, for county anyway, at least. And I would think that might influence what we're doing in this age group as well. And the other thing is, I'm vainly trying to remember, I hope somebody else can, about the £170,000 we were looking at, we voted to set aside, which we may or may not need for holiday hunger and school meals. And I'm not sure if that's COVID money or not.
Yeah, Mark may also want to comment. The £140,000 we set aside for free school meals was from one of our hardship reserves. I think we've now had it clarified. Kick me under the table. From, I hope I'm not speaking that too. We've now had it clarified from the County Council that they will be funding 100% of the holiday period for free school meals. So that means we will need less of that, to use less of that hardship reserve than we were first thinking about. What we are keen to use it for, however, is that the free school meals provided by county, they will not cover preschoolers or college-age students. So we will speak to the Chair and Vice Chair around just looking to use that reserve for that purpose, and that's in line with the original committee decision anyway. So there shouldn't be any issue with that.
Actually, one of the things that's been worrying me about it all is that you have to be receiving certain benefits, and that's the trigger, isn't it, a lot of the time? And for receiving help with school meals, extra school meals. And what bothers me is that there are a lot of people just above that level who are struggling very, very hard and who are going hungry. And are we able to help those?
I think it's a cohort of people that we are talking far more about. Exactly that, Councillor Eager, that there are some families who will automatically benefit from support, and then others who are still financially struggling but aren't able to access that support. I think, are we doing anything specifically targeted at that group at the moment? My answer would probably be no, but we continue to fund organisations such as CAB, Worcester Food Bank, Worcester Community Trust have put in place their community fridge scheme, which we're supporting. So there's lots indirectly that we are doing, but nothing I could say that we're directly targeting that cohort with.
The reason I ask is partly because I was reading, I think it was the Observer. There's quite a bit of research going on in this area at the moment, as you probably realise, and there are 800,000 children nationally in this situation. There must be quite a few in Worcester in this situation, and who need help.
I think there's a lot of awareness about that, and there's I'm at the Health and Wellbeing Board tomorrow, and one of the items on that agenda is the annual joint strategic needs assessment by Public Health, and that's got some quite stark statistics and facts in it, and concerns about increasing numbers of children in families that are in poverty or that are likely to be pushed into poverty. So there is an awareness, and so the proposals are targeted at certain sections, which has been priorities identified by primary care. Any further questions? So is committee happy to support these recommendations and the use of our funding from reserves to put these measures in place?
Chair, should have just said, because of the values involved, the vaccination clinic support is something that can be directly approved by this council. Because of the value of match funding the support, the 2 posts for the mental health support workers, the recommendation is for this committee to recommend onto Policy and Resources Committee the release of that funding. I should have mentioned that at the start. Apologies.
Okay. There's some nice jobs coming up for some people, aren't there? So are we happy then, committee, to sign off recommendation to P&R to be looked at tomorrow? Yep, I'm seeing lots of nods. Thank you. Universal support for that. Thank you very much, everybody. Any other business anybody wants to raise? No. Thank you for your support tonight. Thank you for your enthusiasm, and thank you to officers for all the work that you've done behind this committee. Thank you.